Hello folks, welcome back to Glesga News. Right, okay, it's still the 1st of March 2020. You know, people ask me sometimes, why do you bother giving the date? You know, the year and all that. Well, I think what's in the back of my mind is that maybe in 150 years people will look back on YouTube and they'll hear my voice and they'll say, oh, that's what people sounded like in the days. You know? No, seriously, it's just to try and let you know what's happening on a day-to-day basis. Right, okay, so I've been getting some requests, people asking me for more information, various questions asking about how many cases here, how many cases there, what do you do, how infectious is it, you know, things like that. Should I wear a mask, should I not wear a mask, and all the rest of it. So, given that, as you can see here, we've got 3 people on the subway in the UK wearing masks. Now, I would suggest that they more likely are NHS people who are really clued up, because they look like hospital masks to me, right? So they look to me as though they're clued up, and as NHS professionals would be. They're not taking any chances. But one thing I would mention with regard to this picture, and I'm going to zoom in so we can get a look at it. See, when you're standing on the subway, you hold on to things like that, don't you? She, in fact, is holding on to probably a part there. Now, if she had coronavirus, it would be possibly excreting through her skin and going on to that part of the train. And the next person that's standing there, the next person that's sitting there, could possibly pick it up into their hands. Now, that's why it's most important when you get to your destination to wash your hands, because it could still be on your hands. That's why when you see these pictures on the BBC or wherever, you see them walking about spraying places, because it can actually lie in the area, so they're trying to catch it. So it's very important that you wash your hands, and I would suggest that the Scottish Government make sure the schools, that if they're open now, have outside the classes, just like they do outside the wards in our hospitals. They ask you before you walk into a ward in a hospital to use this sort of chemical. I'm not quite sure what it's called. It's a cleaner, a hand cleaner, and it dries immediately, right? It's like an alcohol-based cleaner, and it cleans your hands. I think all the kids should be doing that every time they go in a class, and every time they go for something to eat, as well as all of us doing the exact same. Right, okay, so the reason I've got this particular one up is just because it's the BBC, and a lot of people don't trust the BBC, and I'm probably one of them, because I think they're all, crazed, liberal, virtue signalling maniacs living in a bubble. But at times they do report factual stuff, right? It says here 12 more patients in England have tested positive for coronavirus, taking the total number in the UK to 35. All right. So, given that number, people then say, well, how many is in Scotland? So there's an official site that's been set up, and I'll include this URL up here in blue. I'll include that in the description so you can go and check yourself on a daily basis, and so you can see. So let's have a quick gander at it, shall we? So it says here, a total of 698 Scottish tests have been concluded as of today. That's the 1st of March 2020. And of these 698 tests, 698 were negative. So as of today, there are no positive cases in Scotland. That doesn't mean it's not here. We understand. Nobody has been confirmed as having it here, according to the Department of Health and Social Care. Okay, now there's also, as it says there, a UK-wide page. So let's go and have a look at that. I'll also include this link. And if you come down, you start to look at number of cases in the UK, and this would be England, wouldn't it? It says as of March, as of 1st of March at 9 AM today, a total of 11,750 people have been tested in the UK. Of these people, 35 are positive. All right. If more cases are confirmed in the UK, it will be announced by the Chief Medical Officer of the affected country. Okay, so it also gives you some advice about returning travellers. If you're coming from Hubei province in China, Wuhan in particular, there's what you have to do. You know, quarantine, self-quarantine. It also goes on to tell you about lockdown areas in Italy. Italy have got it pretty bad. They have over 1,000 cases. I mean, we've got 35 in Britain. They've got 1,000 cases. Now, the other question I'm getting now is, what are the chances of dying if you catch it? Right, okay, well, that's a valid question. It says here, researchers currently think that between 5 and 40 coronavirus cases in 1,000 will result in death, with a best guess of 9 for every 1,000. All right, that's about 1%. So they reckon it might be 2%. So that would be like 18 for every 1,000, maybe possibly 20 for every 1,000. All right. Well, 2% of 1,000 is 20, isn't it? So, but it all depends on certain factors: your age, your sex, your general health, and the health system you are in. Well, I'd imagine the health system is pretty much the same throughout the country, really, isn't it? But here in Scotland, we're quite prepared for it. As I say, this was mainly in the BBC page today. Now, there was an interview this morning with the Health Secretary. His name's Matt Hancock, and during that interview he kind of laid out some no plans as such, but he was revealing the way they're looking at it. So he's saying basically that we've got different stages, certain stages of some sort of emergency. So at the moment we've got the containment stage. So that's anybody gets it, try to contain it, try to quarantine them, try to stop the spread, and so they can either get over their infectious period and try and contain. But they're also watching Europe. They're also watching what's happening outside the country. Now remember, we're on an island, so we're a bit better off than Europe. Remember, they have open borders over there. It's unbelievable, but they've not closed their borders. I don't think they can close their borders. You see, you've got the Schengen Agreement, and I think that's going to be the total destruction of Europe. Not only has it caused massive amounts of immigration problems and all sorts of other issues related to that, when you get a virus coming in, it'll just sweep straight through the entire continent, because you can't lock the system, you can't lock it down. They're saying we're not going to do it. That's because they can't do it. All right. Right. Okay. So I'm now going to take a wee look at this interview with Matt Hancock.
The government says it's ordered a so-called war room to be convened in the Cabinet Office to roll out a new public information campaign. It also says it's considering bringing retired health professionals back into the NHS.
There's a government paper which was leaked this week which suggested that 80% of the population of this country could ultimately, in the worst case, become affected, and 500,000 people could die. Is that a serious prospect for us?
Well, we're not putting figures on those numbers.
Well, you did in that paper.
Well, the paper refers to, and our planning assumption for the reasonable worst case scenario, not the central case, the worst case scenario, is based on what would happen in the event of a pandemic flu. Those planning assumptions have been out in the public domain for many years, and that's what we've been working with our practice sessions before this virus existed. We practice on and plan on those sorts of numbers all of the time. Now, we don't have a projection for this particular virus, not least because it's outside of China, it's still in its early stages. So we do have, though, a clear plan based on a reasonable worst case scenario and based on what could happen. We plan for the worst and we work for the best.
Sure.
That is the approach that we take.
So what is the worst case scenario?
Well, under the worst case scenario, we would have to take some quite significant actions that would have social and economic disruption. And you've already seen some other countries take some of these actions. And we'll be publishing a battle plan this week that sets some of those sorts of things out.
Just tell us a little bit of the kind of thing that we might expect if the worst case happens.
Well, it may be necessary, and I'm not saying any of these things are decisions we've taken, but they're things that we don't rule out. It may be necessary, for instance, to close some schools, but right now people should not be closing schools if there isn't a positive case and they don't have the advice from Public Health England. And other so-called population distancing measures.
So, for instance, France is banning all public gatherings inside of more than 5,000 people. Is that the kind of thing that we too might have to look at?
Well, we are looking at all those sorts of things. We do not rule them out, but there's also a problem if you make decisions like that too early.
I absolutely see
because
that.
The top priority is to keep the public safe. But we also want to minimise the economic and social the consequences.
You don't want to jump into it too fast, but things like banning football events, banning big concerts, and trying to dissuade people from using public transport, are those also on the list of possibles?
Well, we're looking at all options.
Including those?
Including those, but we will only look at things that epidemiologically, scientifically make sense. So taking the scientific evidence is incredibly important, and then you have to take into account the social and economic consequences. You know, people said to me a few weeks ago we should ban all the flights from China, and the scientists said that that would be like creating a Maginot Line. People would come around it.
It wouldn't be worth
it. And it wouldn't be clinically effective. And there's only one country in Europe that did ban the flights from China. That was Italy.
Italy. It didn't work very well there.
And they've had so in a way that's proved that what you have to do is take very seriously the scientific advice. But of course, these are decisions for politicians and the whole of government, taking into account all the consequences. But there's one other really important point here, Andrew, which is that there is an incredibly important duty for government. But there is a duty on each and every person to do what is needed.
To wash their hands.
Wash your hands, and to make sure that if you have a cough or a sneeze, then you catch it, and also to follow the public health advice. If you think that you've got it, phone NHS 111, and if you're asked to self-isolate properly. You know, this isn't something that a government can do on its own. Everybody has a duty, and we're very clear about what that duty is.
Absolutely get that. But coming back to the government, you are taking emergency powers this week, or you're announcing possibly emergency powers. What kind of powers are they going to be?
Well, we're working on...
What does it allow you to do, I suppose?
Well, it's a very important question. We're working on emergency powers, should we need them. In our four-part plan, our four-part battle plan, we're still in the contain part. That means that for every single case, we give, of course, them the best possible care, but also get in contact with all the people they've been in contact with. That is the right phase now, in the hope that we can, by doing that work, stop this from becoming pandemic. Should we move from the contain phase, and the scientists tell us that it's inevitable that it's going to go right through the world and therefore become endemic here, because you can't stop these things from becoming endemic. Then we're into the delay phase, where we have to take judgments about how much action to take that might have downsides and costs in order to delay it. Then we have, all the time, we have the research phase, and if it comes to it, we'll have mitigate, which is to mitigate the damages.
Well, looking at the next phase, the second phase, as it were, if it's inevitable that it's going to spread everywhere, and again I ask about these emergency powers.
Yes.
Would that allow you, for instance, if somebody is asked to be isolated or to self-isolate and refuses to do so, you could grab them and isolate them? Is it that kind of thing? Could you cut off communities or housing where there is coronavirus?
Well, we actually have already taken the power that was provided for in a 1984 Act to be able to quarantine people. So, as you know, we've been quarantining some people who've come back from very affected areas.
But if somebody doesn't want to be quarantined?
Well, we have the power now to ensure that they are, and so that the police can assist us in doing that. So that power has already been taken, and the potential future powers are actually about enabling people to respond. So, for instance, at the moment there's rules in law about the ratio of children to a teacher or in a childcare setting. Those rules are. But there's one other really important point here, Andrew, which is that there is an incredibly important duty for government, but there is a duty on each and every person to do what is needed.
To wash their hands.
To wash your hands, and to make sure that if you have a cough or a sneeze, then you catch it, and also to follow the public health advice. If you think that you've got it, phone NHS 111, and if you're asked to self-isolate properly. You know, this isn't something that a government can do on its own. Everybody has a duty, and we're very clear about what that duty is.